Hi, I'm Dr. Glenn Czulada. I practice chiropractic in Dunmore, Pennsylvania. In today's video lesson, I want to talk about the areas of the spine and the different problems that can happen in each area. Here's a sample spinal plastic spine. We can see the pelvis, the hips, the sacrum bone. The areas of the spine are the sacrum, the lumbar spine. This is the mid-back, which starts at the top of your neck and goes into the top of the lower back. And then the purple, of course, is the cervical spine. Now, in the spine, there are 25 separate vertebrae, which includes the pelvis. The vertebrae are the main part of the spine. Between the vertebrae are the vertebral discs. These are a rubber-like, washer-like material that allow the spine to move. Between the vertebrae and the disc are the spinal nerves. These can be very much easily pinched, and when they're pinched in the lower back, they cause sciatic nerve pain. When they're pinched up in the neck, they cause pain, numbness, weakness, and radiating down into the arm, almost down into the hands at times. And then the other part of the spine we will call the spinal joints. That's where the spinal vertebrae connect, okay, in the back of the spine. And then the last part of the spine, which is not shown here, and maybe one of the most important parts for many of you, are the spinal muscles. There's 3 layers of spinal muscles that cover the entire spine. So, as a chiropractor, I'm going to evaluate you and try to find out which of these areas is causing your problem. Is it the spinal vertebrae? Are they wearing? Is there deterioration? We can see that very clearly with an x-ray. The discs. If the discs bust out, like right here, that could be causing pressure on the nerve. That's going to cause shooting, radiating, maybe even severe pain shooting down the leg in the lower back or the arm in the neck. But the nerve, we'll talk about the sciatic nerve, because the pinched sciatic nerve is more common than a pinched nerve in the neck, can also be caused for other reasons. It can be caused by these vertebrae going out of alignment and pinching the nerve. They can also be caused by muscle spasm, moving the vertebrae closer together. And they could also be caused by muscle spasm in the hip. The other thing we see very often are when these vertebral joints, which I referred to, go out of alignment. They get locked, they get stuck, they get stiff. That's what my patients say. They say, I feel stiff. Someone come in and say, Doc, I feel like my back needs to be popped. That's a sign that these vertebrae are out of alignment and locked together. And chiropractic will restore that movement and unlock those vertebrae. Then the last problem are the spinal muscles. And they can be pinched, they can go into spasm when any of these structures are irritated. And what will happen is the spinal nerves get irritated and they get very sensitive. And that sensitivity, they will tell the muscles, go into spasm, tighten up, something's wrong with the spine. So as a chiropractor, we have to work on all these structures. The spinal vertebrae, the discs, the nerves, the joints, and the muscles. Now, I didn't really get into detail about many of the other conditions that can be caused by this, but this is a good foundation.